So the next one is the semicarpus anacardium, and the image we can see that the seeds are black color seeds, and the shape is similar to the heart. So it is called as the semicarpus anacardium, and it is also called bilavinol. And the active principle is the bilavin, and the seeds are concavo-convex seeds, and it is used for making the artificial bruises in which the vesicles are very important features. So it is a previously a question many times that it is used for making the artificial bruise. The next one is the Averus pectorius, or the we also known as the rati or the gunchi. So they are the bright red color seeds or the fruits. They are the bright red color and with the blackish part on the top. So blackish part on the top we can see, and rest of them is the red color. So active principle is abrin, and it is used for making the sewers or the needles, and they are the vasculotoxic. So they will represent, they will mimic the poisoning of the viper bite, and as they are vasculotoxic, that they will also lead to the hemolysis, DIC, coagulopathy, etc. The next one is the Atropa belladonna. Atropa belladonna is also called as the deadly nightshade, and the active principle is atropine. As we know that the atropine is the anti-parasympathetic or anticholinergic. So all the symptoms of the anticholinergic will be there, such as the dry mouth, dry eyes, and urinary retention, etc. The next image is of the castor or the arundi, and it is a resinous plant. So here we can see many small fruits are there, which are the thorns on them, but they are different from the uh, image that we have seen in the case of the datura. In datura, the single fruit is there. Here, multiple fruits are there, and all the parts of the castor is toxic except the castor oil. Castor oil we also use for eating or hairs, so it is non-toxic. Rest all the parts of the plants are toxic in the castor. Then the second last is the rye, and it has the ergot poison. So here we can see this is the rye. It is very frequently seen in the wheat crops, and here we can see the ergot blackish part. So inflammation of the palms and soles will there with the rye poisoning, and tactile hallucination will be there, and we have seen that the tactile hallucination is also present in the case of the cocaine bugs. So here also we can see the tactile hallucination. So it is important, if we the question comes that the tactile hallucinations are seen in, so we have to mark both the answer. So it will be a type of a multiple choice answer. Now the last one is the chili seeds. Chili seeds that we have seen that we can also see in the chili flakes. So it will lead to the dermatitis or the Hunan hand. So there will be a reddish color hand will be there, and inflammation will be there. Severe itching will be there. Now, next we will talk about the metallic poisoning. Firstly, we will talk about arsenic and the lead because they are very important for us. Then after that we will discuss about the phosphorus, mercury, cyanide, and carbon monoxide. Firstly, we will start with the arsenic poisoning and the lead poisoning. So firstly we will see the image. So here we can see there are many pigmented and the depigmented part is there. So this is called as the raindrop pigmentation. Raindrop pigmentation is a feature of the arsenic poisoning. Now here we can see in the foot there is various blackish nodules are there, This is called as the Blackfoot disease, and it is also a feature of the arsenic poisoning. Here we can see that the heart is there and the hemorrhages are there. These are the subendocardial hemorrhages. Subendocardial hemorrhage or the Sheehan hemorrhage are also the feature of the Sheehan hemorrhage or the subendocardial hemorrhage are also the feature of the arsenic poisoning. In the last, we can see in the nails white lines are there. So white transverse lines are there, and these are called as the Eldridge Mees lines. So Eldridge Mees lines is also a feature of the arsenic poisoning. So we have seen Eldridge Mees lines, Sheehan hemorrhage, and Blackfoot disease, and also the raindrop pigmentation and raindrop lesions. So these are important feature of the arsenic poisoning. Now we talk about the lead poisoning. Then in the lead poisoning, we can see on the gums bluish or the blackish lines are there. This is called as the Burtonian line. And in the RBC we can see various blue dots are there. This is called as the basophilic stippling of RBC. And this is the image of the mercury poisoning, Minamata disease, and mainly seen in the Japan. So firstly we will talk about the arsenic and lead, then we will come on the other one. So if we talk about the arsenic, then the fatal dose is 100 to 200 mg, and the poisoning by the arsenic resembles the cholera, but initially the stools will be dark. Later they will be similar to the cholera, which are the rice water stools. And damage to the PCT of the nephron will be there, and it can also be found in the exhumated body. So if the person is dead for the thousands years or almost 100 or the 1000 years, and the exhumated body and when we exhumate the body or we again dig it out, then we can see the traces of the arsenic poisoning in that also, and it will lead to the Blackfoot disease with the peripheral neuropathy. And the peripheral neuropathy or the neuropathy in the cases of the arsenic is, it is mainly a sensory neuropathy greater than the motor. But we have to remember that in the lead, the neuropathy is only the motor, and which is greater than the sensory neuropathy. And in the arsenic, we can see the raindrop pigmentation that we have already seen, Eldridge Mees line, and smell will be garlicky in the case of the arsenic poisoning, and the red velvety mucosa will be there if it is seen in the postmortem reports. Sheehan hemorrhage or the subendocardial hemorrhage are present that we have already seen over here. So the antidote for the arsenic poisoning is the BAL, British anti-levisite, which is also called as the dimercaprol. If we talk about the lead or the lead poisoning, also called as the plumbism, and BBCW are the feature. B for Burtonian line, which we have already seen on the gums. They are the bluish or the blackish line, and next B is for the basophilic stippling, which we can see in the RBC. Then C for the constipation or the colicky pain, which is also called as the painter's colic, because the lead is mainly present in the paints, so it is also called as the painter's colic. And W for the wrist or the foot drop. So wrist and the foot drop is there because the motor neuropathy is mainly the feature of the lead poisoning. Now it will inhibit the enzyme, so we can remember by the uh, word lead only. Le for the chelatase, and Ad for the ALA dehydratase. So Ad for ALA dehydratase, and from the Le we can remember that in the ferrochelatase Le comes. So ferrochelatase and the ALA dehydratase. Neuropathy will be mainly the motor greater than the sensory, and then we have to remember the cab map. In the cab map, C for the cabot ring, A for eosinophilia, B for basophilic stippling, M for microcytic hypochromic anemia, uh, and A for anisocytosis, and P for poikilocytosis. And the treatment for the lead poisoning is it is according to the severity. If the concentration is less than 30 microgram per dl, then we will use the succimer. If it is between 30 to 70, then we will use the EDTA, which is specific chelating agent for the lead. And if the concentration is greater than 70, then we will use EDTA plus BAL. So EDTA plus BAL is used in the case of very severe poisoning. In the moderate poisoning, we use only EDTA, and in very mild poisoning, we use the succimer. Now the next one is the phosphorus. So in this image, we can see jaw. There is a abnormality of the jaw, and this is called as the phossy jaw. And phossy means phosphorus. So it occurs due to the phosphorus. So phosphorus can be of two types: white phosphorus and the red phosphorus. The red phosphorus is not toxic, or it do not have any smell. So it is not harmful for us, but the white phosphorus is very harmful. It is a toxic. It has a smell, which is a garlicky smell, and it is used as a Diwali poisoning. So it is used in the crackers, but the red poison used in the side of the matchsticks, that we have seen in the side of the matchsticks. The clinical feature for the white phosphorus is the phossy jaw, and the hand tremors will be there. But in the case of the red phosphorus, there is no phossy jaw. In the treatment for the phosphorus poisoning, we use the copper sulfate. Now we talk about the mercury. As we have seen already the image of the Minamata TG, which is seen in the which is very common in the Japan. It is occur due to the mercury poisoning. Also acrodynia or the can occur. Mercurial lentis can occur. Hater shake can occur. Hater shake is a type of the coast tremors, and it is also called as the glass blowers shake. And erythrism can occur. So antidote for the mercury poisoning is also BL. And BAL is also an antidote for the arsenic. And the next one is the cyanide. If we talk about the cyanide, then it is the ideal poisoning for the suicide, because it will lead to the very sudden death, and it is a bitter almond smell, and pink color mucosa will be there, seen in the postmortem report. And antidote for the cyanide poisoning is the amyl nitrate or the vitamin B12. It is a kit which is used for the cyanide poisoning, in which the amyl nitrate will be there, vitamin B12 will be there, cobalamin. And if we talk about the carbon monoxide, then cherry red hypostatis can be seen in the postmortem, and it causes anemic hypoxia, because carbon monoxide has more binding capacity than the oxygen with the RBC, so it will lead to the anemic hypoxia. And some of the tests are done, such as cellular test or the Kunkel test, are done for the carbon monoxide poisoning, and treatment is the hyperbaric oxygen, because hypoxia is there. So firstly the treatment will be the hyperbaric oxygen. Now we talk about acids and alkalis. So it is important to remember that in the acids and the alkalis poisoning, alkali will cause more damage to the GIT or the gut, and it will lead to the liquefactive necrosis, but the acid will lead to the coagulative necrosis. The damage will be little lesser than the compared to the alkalis. If we talk about the acids, then firstly we'll talk about the oxalic acid, then carbolic acid, then H2SO4, which is king of all the acids, then HNO3, H2S, then we will talk about the boric acid. So firstly we will start with the oxalic acid. Oxalic acid will lead to decrease in the calcium levels, hypocalcemia. So tetanic feature will be there in the case of the oxalic acid, and clinical feature is the coffee white vomitus will be there. And treatment will be the wall scraping of the wall will be we will do, and we will give the calcium gluconate. So in the oxalic acid, we have to remember only that the technique feature due to the decreased calcium and the calcium gluconate and the wall scraping for the treatment. In the carbolic acid, it is also called as the phenolic acid. It is a corrosive acid, and it will lead to the leathery stomach appearance. Leathery stomach appearance because the gauge which are present in the stomach will be inflamed in the case of the carbolic acid, and it will lead to the leathery stomach appearance. It will also lead to the onchronosis, and gastric lavage is not contraindicated. So we know that the gastric lavage is contraindicated in the cases of the corrosive poisoning. So, but carbolic acid is also a corrosive, but gastric lavage is not contraindicated in the carbolic acid. And green color urine will be there, which is called as the carboluria. Now we talk about the H2SO4. H2SO4 is also called as the oil of vitriol, and it is a very strong or the strongest poison. And the clinical feature is it will lead everything black except the teeth, which will be a chalky white. So in the case of the H2SO4, everything will become black from the gut and esophagus, stomach, mouth, etc., oral cavity, but only the teeth will be a chalky white. Antidote used for the H2SO4 poisoning is the MgO. It is used to just neutralize it. And what is vitriolize? Vitriolize is throwing off acid on another person. So IPC for the vitriolize is 326A for the acid attack, and if it is attempted, then 326B. Now HNO3. So in the postmortem, yellow stomach mucosa will be there, and in the boric acid, boiled lobster appearance will be there. So these are all the acids or the alkalis which are important for us. Now we will talk about the alcohol. In the alcohol, we have to study two alcohol mainly, ethanol and the methanol. Ethyl alcohol or ethanol and methanol, which is a methyl alcohol. Methyl alcohol is more dangerous because it will lead to the host tragedy. Host tragedy means there are sometimes news that in a area 50 to 60% died in a day, and then later it is found that they have consumed alcohol, similar alcohol. So this type of alcohol which are local or mixed with methanol will lead to such tragedies. And so methanol will lead to the blurring of the vision, and the fatal dose for the methanol is very less, which is 80 to 120 ml, and no field vision will be there. Treatment is hemodialysis, no other treatment is there. And for the antidote, we can give ethanol or the fomepizole. So ethanol is given for the methanol poisoning because ethanol is less. They both use the same enzymes. So and ethanol is less dangerous or less toxic. So when the methanol poisoning is there, we will give ethanol so that ethanol can use all the enzymes, and methanol will not be used to make the formic acid. Now, if we talk about the ethyl alcohol, then the driving limit in the India is the 30 mg%. And if we talk about the other symptom, so they are according to the concentration of the alcohol. So if the concentration of the alcohol in the body is 80 mg%, then nystagmus will be there 150 mg%, then motor incoordination will occur, and greater than 300 or 400 mg%, coma or death will occur. So it is important to remember the driving limit, which is a 300, and greater than 300 or 400, it will lead to the coma or the death. So it is very dangerous. withdrawal. If we talk about the withdrawal of the alcohol, then mostly the question is asked on the delirium tremens, which we can see almost 2 to 3 days after the withdrawal, and there will be visual hallucination, irrelevant talking, tremors will be present, and so the person is considered insane at the time of the delirium tremens. So if he commit any crime during this, then it will come under the rule of insanity or the McNaughton's rule, and the person will not be responsible for the crime. And the test we can do for the checking the concentration will be drunkometer or chromatography. So drunkometer is used by the police, traffic police commonly. Now, increase in the alcohol concentration will lead to the decrease in thiamine. So decrease in thiamine do not occur suddenly, it will occur due to the chronic alcohol poisoning, alcoholism, and decrease in thiamine or vitamin B1 will lead to the Wernicke's encephalopathy and the Korsakoff psychosis. So in the Wernicke's encephalopathy, to it is important for us to remember the GOA, which stand for the global confusion, A for over ophthalmoplegia, A for ataxia, and also the short-term memory loss will be there, STML. In the Korsakoff psychosis, ACP will be there. ACP means amnesia, confabulation, which is very important, and polyneuropathy. So this is also added in the NEET 23. Both of them are added. Now we will discuss some other miscellaneous topics such as the organophosphorus poisoning. So organophosphorus is present in the pesticide, insecticides, etc., and it will lead to the irreversible competitive inhibition of the acetylcholinesterase enzyme. So when the acetylcholinesterase enzyme is damaged, then it will lead to increase in the ACH concentration. So it will lead to the cholinergic effects. So cholinergic effect we can remember by the mnemonic sludge P. In the sludge, salivation and sweating will be there. L for lacrimation, U for urination, D for defecation, G for increase in the GI motility, and E for emesis, and P for the pinpoint pupil, which is very important. Pinpoint pupil is also seen in the opiates or the morphine. So effects of OP poisoning will be both muscarinic and the nicotinic, and treatment is atropine, which is an anticholinergic, and the 2-pump or the auxine, which are used to replace or regenerate the acetylcholinesterase enzyme. So they are the activator of ACH enzymes. And the side effect for the atropine is as in the previous year, which is the hyperthermia. So this is the PYQ. Now we talk about the cadmium, then it will lead to the ita disease or bent bone disease. So here we can see the image, then there are bent bones. So it will also lead to the muscle pain and the proximal tubular damage in the nephrons. So we have to remember the ita disease. In the thallium toxicity, hair loss will be there in the lateral 1/3 of the eyebrow. So here we can say eyebrow and the lateral 1/3, there is the loss of hairs. So it is very important because it is previously asked once. Now we will talk about chelating agents, as we have already seen, which is for the lead we can we can remember from the AD EDTA, for arsenic from the A BAL, for mercury also BAL is there, for copper in the penicillamine C is present, and C is not present in any other chelators, so we can remember from the C copper. And for the iron, desferoxamine, ferro is present in both deferriprone or the desferoxamine. So these are the chelating agents, and EDTA is contraindicated in the mercury poisoning, BAL is contraindicated in the iron or the cadmium, and penicillamine is contraindicated in the arsenic. So these are not so important, but but these are important to remember the chilators of all the poisoning, metallic poisoning. If we talk about the smells, then in the cyanide poisoning, bitter almond smell will be there. In the arsenic, garlicky smell will be there. In the H2S, rotten egg. It is in the previous year. It is also added in the previous year. Cannabis or the bhang, we have seen that burnt rope. It is also added in the previous year. Then ethanol, fruity smell will be there, and nitrobenzene, shoe polish smell. And hemlock, it is a nerve poison in which the carrot-like smell will be there. So these are very important for us because these three are very important because they are previously added in many papers. Now postmortem staining in the case of the poisoning. If we talk about the postmortem staining, then they are also added in many exams. So cherry red staining is very frequently asked question, and it is seen in the carbon monoxide poisoning. Then in the H2S we have seen that the grayish blue or the bluish green, in the HCN bright red, in carbon monoxide cherry red, which is very important, in the carbon dioxide blue, opioids black, and in the PA and PAN, phosphorus, aniline, and nitrate, brown color hypostatus will be there, and in the CN, brick red will be there. These are similar. Now, if we talk, a previously asked question is there, so it is asked that the quinine is used for the abortifacient, and chloral hydrate is used for the stupefying agent, zinc chloride is used for the as a irritant, and potassium chloride is used as a corrosive. So it is a previous year question. So we can remember all of them because it can be again asked in the NEET. So it is asked in the INICET. Now some of the one-liners. So most widely used illegal drug. Illegal drug is the cannabis, but if we talk about the most widely used legal drug, then it is a tobacco. That we can say that tobacco chewing is very common in the India. So it is a legal drug. But if we talk about most widely used illegal drug, then it is a cannabis. In the cannabis, we know that the bhang, charas, ganja, marijuana, it all come in the cannabis. Now, if we talk about the ideal homicide poisoning, then it is a thallium. If we talk about the ideal suicide poisoning, then it is a cyanide. And ideal suicide poisoning in India is the insecticide, which is the organophosphate, because it is very easily available for farmers. So, in any case, in any time of the crisis, such as we have seen in the COVID time, that many of the farmers died due to OP poisoning. So it is very commonly used for suicide in India. What is speedball? Speedball is the heroin plus cocaine. So it is also added in the previous year. It is also added in the previous year. This is also added in the previous year. Now we talk about fatal doses of some of the important poisons. So for strychnine, one crushed seed is sufficient to cause the poisoning. In the Jamalgota or the Nepala, 4 seeds are required for poisoning. Arandi or the castor 10 seeds, and in the Datura 100 seeds. Cocaine. If we talk about cocaine, 1 to 2 gram. If we talk about arsenic, 100 to 200 milligram, and methanol 80 to 120 ml. So these are important fatal dose that we have to remember because they are previously asked in many papers. Now we talk about the contraindication. So contraindication, we have to talk about gastric lavage contraindication and the hemodialysis contraindication. So if we talk about the gastric lavage, that we know that the gastric lavage is contraindicated in the case of the uh, corrosives or the kerosene or the convulsion poisons. So these are gastric lavage is contraindicated in corrosives, but in one corrosive it is not contraindicated, which is the carbolic acid. In kerosene and convulsion poison also it is contraindicated. And Eval's tube is used for the gastric lavage, which is 1.5 centimeter, and the it is a previously asked question, image based question. This is the Eval's tube in which the conical structure is present on the one end, and it is 1.5 meter, and no, this is not used in the children's. This is not used in children's. Now hemodialysis is contraindicated in KBCH. So kerosene, benzodiazepine, copper sulfate, and heroin. So this is also a PYQ. That hemodialysis is contraindicated in which kerosene is given. So we have to mark that answer. Kerosene, we have to remember KBCH, kerosene, benzodiazepine, copper sulfate, and the heroin. Now, if we talk about the inhalant poisoning methods, inhalant poisoning methods can be if the person is using a bag, then it is called as the bagging. If person is directly uh, if he using the balloon, then it is called ballooning. If it is directly inhaling from the container, then it is called sniffing or snorting. If is using the spray and then inhaling it, then it is called as the spraying. And if he is using the cloth, it is called huffing. So huffing we can remember by the H for handkerchief. So bagging, ballooning, sniffing, huffing, and spraying. So bagging is asked many times, and huffing is asked many times in the previous years. Now we talk about the smuggling. So in the smuggling, we have to know about body packer syndrome and the body stuffer syndrome. In the body packer syndrome, we have to remember that in the body packer syndrome, our drug is packed in the any balloon or the condom or any polythene. Then it is swallowed by the person who is smuggling it, and at the destination, he will use the laxatives to excrete them out. And complications can occur if the polythene or the condom burst inside, because it generally contain a poisonous or the harmful drugs which can be poisonous. In the body stuffer syndrome, these polythene or the condoms in which the drug is present is kept inside the body cavity, such as the anal canal, vagina, nose, ears, etc. So this is the X-ray image of the body packer syndrome, in which we can see various capsule-like structures are present in the intestine. So this is all about toxicology, and we have covered all the topics which were asked in the previous 5 years in the INI, CET, NEET, or the FMGE, and all the important PYQs are also included in this PDF only. Thank you.